Entering room, I've checked the door for flags. Patient is on standard precautions. There are no environmental hazards that the patient could fall or slip over. Perform hand hygiene. Good morning. My name is Jennifer and I'm going to be your student nurse today. Could you please tell me your name and date of birth?
Faith Raymore, December 4th, 1970.
Thank you, Ms. Raymore. Do you have any allergies?
No.
Okay. Can you tell me where we are today?
John Tyler Hospital.
And what floor are we on?
First floor,
Okay. Can you tell me today's date?
December 2nd.
Okay, wonderful. Can you tell me what brings you in today?
Tubal ligation.
All right. As we do with all of our patients, we're going to do an assessment. First, before we begin, I just wanted to assess your pain on a scale of 0 to 10, 0 being no pain and 10 being the worst pain imaginable. What are you feeling this morning?
I just had some pain medication like an hour ago, so 0.
Okay, wonderful. First, what we're going to do is I'm going to have you follow this pen light. Patient is laying supine at about a 45-degree angle in bed. Her expression is relaxed. Her level of consciousness is awake, alert, and oriented times 3. Skin color is light tan, consistent with race. Hearing seems to be intact, as evidenced by her ability to answer questions without asking me to repeat. Speech is fluent and articulate. She appears well nourished, and hygiene is good. All right, if you can just follow this light with your eyes. Very good. And if you can just look straight ahead, I'm going to shine this in your eyes, okay? Very good. Pupils are equally reactive to light bilaterally, 3 millimeters. Next, I'm going to have you grab my fingers, and I'm going to pull. Can you squeeze them? Very good. And I'm going to pull towards me, you pull towards you. And I'm going to push towards you, you push towards me. Very good. And can you put your hands like this, and then flip them back and forth. All right, and again. Very good. And what I'm going to do now is assess your sensory. This is dull, and this is sharp. And if you can close your eyes and tell me what you feel.
Dull. Dull. Sharp. Dull. Sharp.
Very good. All right, and I am going to assess your leg strength too. And if you can push against my feet, and then lift your feet against my hands. Thank you. And I'm going to put my fingers here. Can you swallow for me? Very good. Do you have any pain with swallowing, any difficulty with swallowing? Okay. Now I'm going to listen to your lung sounds. And can I get you to sit up for me? All right. And whenever you feel the stethoscope touch your skin, I just want you to take a deep breath, please. All right. And can I get you to cough for me? No mucus, no sputum when you cough? You don't have a cough? Okay. No mucus, no sputum. Breath sounds are equal bilaterally, clear. Patient is on room air, no oxygen is ordered. Respirations are unlabored, no use of auxiliary muscles. While we're here, let's listen to your heart. Alright, so first I'm going to actually listen to your apical pulse, which is here. And if I was taking your apical pulse, I would listen for a full minute. Apical pulse is regular, and I'm going to check against your radial pulse for a deficit. No deficit is indicated, you sound fine. And then I'm going to listen to your aortic, pulmonic, first point, tricuspid, mitral, and then I would repeat with the bell, aortic, pulmonic, first point, tricuspid, and mitral. S1 and S2 sounds heard, no extra lung sounds heard, or I'm sorry, no extra heart sounds heard. Rhythm is regular and strong. You sound great. I'm going to check your capillary refill. And that is less than 2, so that's great. And patient has no IVs, otherwise I would check IVs for rate and signs and symptoms of infection at the site. I'm going to check you for edema. Patient has no signs of post-tibial edema. Pedal pulses are equally strong bilaterally, 2+. Post-tibial pulses are equal bilaterally, 2+ as well. Okay, and then as far as your skin, I'm going to check your skin turgor. Patient's skin turgor is less than 3. That's good, means you're hydrated. No lesions, skin color is even, consistent with race, light tan. There are no bandages, no signs of skin breakdown. You're able to ambulate, okay? You can get up and walk around, reposition yourself in bed.
Yes.
Okay. Patient is at a low risk for developing skin lesions. Braden scale is 23. Let's check your abdominal area. And I'm just going to listen first. And I'm going to start with the lower right quadrant, and I'm going to go around clockwise. Okay, vowel sounds are present in all 4 quadrants. Abdomen is round. Are you able to pass gas and stool okay? When
Yes.
was your last bowel movement?
Last night.
Okay, what was the consistency like? Was it loose or hard or firm, formed?
Firm, normal.
Okay. Are you having any difficulty passing stool?
No.
No blood in your stool?
No blood, no strain, no nothing.
Okay. And then are you able to tolerate your diet okay, or do you have any food intolerances that cause you issues?
None.
Okay, very good. And I'm going to palpate right now. If you have any tenderness, please let me know. Does that feel okay? Okay. Very good with that.
It only bothers me when I have to pee,
Well, when's the last time you voided?
like an hour ago.
Okay. And what was your urine like? What color? Was it light or?
Yellow, normal,
Okay. Was it cloudy at all or clear that you noticed?
clear, I think.
Okay. And how many times a day do you void?
Oh, like 5.
All right. And any pain, burning, foul odor when you urinate?
No, it's not.
All right. And as far as activity, patient is not on bed rest, but the head of the bed is at about 45 degrees. Do you need any assistance when you get up and ambulate, go to the chair, walk to the bathroom?
No, I'm good.
Okay. Patient is not a fall risk. She is a 0 on the Morris Fall risk scale. Okay, well, in closure, what I would do at this point, ask you if you have any other questions.
I don't think so.
Okay, the bed is in locked position. It is at the lowest level. There's no need for a bed alarm, and side rails are up. The call bell is right here if you do need anything. And this concludes our assessment. Thank you so much. And I would perform hand hygiene once again and document my findings.